The vaccine is now being given to frontline workers in Orange County. CBS 2's Joy Benedict is live at Hoag Hospital in Irvine, where it's bringing some sense of hope to those who are receiving it. Joy, good morning to you.
Good morning, DeMarco. That's right. It is day 4 of Vaccine Watch, as we've been watching folks get vaccinated all over Southern California. And today it is high-risk frontline workers here in Orange County at the Hoag Hospital system who are choosing to get vaccinated. They lined up and rolled up. But healthcare workers at Hoag Hospital in Irvine say they aren't choosing to get vaccinated because of public policy. They're doing it because of their patients.
Patients are getting more sicker. We're dealing with more COVID patients. So obviously, I want to protect myself and, the community.
Michael Bowie is a nurse on the heart monitoring floor. He was one of the first in line. Critical care nurses Mary Carrillo and Angela Hardy were right behind him.
We're just so full right now. Definitely, I think a lot of us who maybe were nervous about the vaccine said, no way, we have to get this now. We have to stop this.
It's a little scary to walk into the unit full of COVID patients and then have to go home to our families.
And as if everyone here hasn't already done their part, they're now doing even more, volunteering to be part of the first wave of high-risk first responders to get vaccinated.
It's hopefully going to be a sigh of relief once we get the second dose and know that the immunity is kicking up.
Orange County started vaccinating 25,000 high-risk frontline workers yesterday. Nurses and doctors dealing directly with patients who have COVID-19.
They're on ventilators, which there are no masks you can wear with ventilators, and we're up close and personal for a long time taking care of these patients, in these rooms.
I was very excited to have one of the first slots to get the vaccine.
Dr. Angelique Campen works in the ER at Providence St. Joseph's in Orange. She got her shot last night.
I have no systemic symptoms. I feel perfectly normal. I just feel like I'd worked out a little too hard on my arm.
And that's what those vaccinated are hoping for today. Minor discomfort, little side effects, and a chance to help stop this spread while still helping those sick heal.
If the vaccine is offered to you, highly consider it, and just know that it's not just protecting you, but could potentially protect others that aren't able to get it.
And that's what this is all about, right? Now back out here live in front of Hoag Hospital in Irvine, you can see we're in front of the emergency room. They also have the triage tents in front, trying to determine the best place to put patients, as they are seeing an influx of COVID patients here, as they are at hospitals all over the area. But remember, this is just the first wave, and that is vaccinating the healthcare workers. The state of California is hoping to get 2 million of them vaccinated before the end of the year. As for when you or I or the average person can go get a vaccine, though, it may be several months. We're looking at late spring, possibly even early summer. Guys.
It is another reminder, don't let your guard down. Joy, thank you for that.